everybody. As much as I'd love to continue listening to the Star Wars theme song, the reason why we are live streaming today with the help of our fantastic music is to teach everyone that today begins Fraud Prevention Week for 2023. Very, very exciting. And as I'm sure you can imagine, fraud is happening out there every single day. And it comes in many different shapes and sizes and forms, right? So some is intentional, some is unintentional. But I want to teach everybody today how to be a fraud fighter. Just so everybody knows up front who I am, you may have seen me on the agency's Facebook account in the past. My name is Shelby Jones. I am the SHIP program manager for the Baltimore County Department of Aging, and I also am the program manager for SMP, which stands for Senior Medicare Patrol. And our job in SMP is to prevent and fight Medicare fraud. So hence why we are really highlighting this presentation today. This is going to be a quick 12 o'clock lunchtime presentation. I just want to try and share with you some information about prevalent scams that are happening right here, right now in Baltimore County, and to people who may have otherwise thought that they knew everything there is to know. Because sometimes it's not even about answering the phone. Sometimes it's about who has your information that you don't know has your information. Okay, so first, let's get started and let's just talk about why being a fraud fighter is so important. Last year alone, Medicare lost over $60 billion. That is an incredible amount of money. And as a federal program as a whole, that's huge, right? It's also totally impossible to calculate the amount and the cost that is lost to beneficiaries, right? And I'm not even talking about funds, right? Like monetary costs that have been lost to beneficiaries, but also the loss of sense of security. Maybe now folks have PTSD or anxiety from having their identity stolen or being a victim of Medicare fraud. Okay, so it can definitely have different costs in different ways to many people, okay? And also it jeopardizes the quality of our healthcare system. If services are being billed and issued to people who don't need them, what happens when the people who need the services show up actually needing them, right? Prime example of this is ambulance fraud, right? Folks who don't really need an ambulance to get to something like, let's say, dialysis services because it's non-emergent, if they're taking ambulances to and from their dialysis treatments, and that wasn't pre-authorized by Medicare, you're taking an ambulance away from someone who may need that service in the event of an emergency. So it is so incredibly important to stay fresh and sharp as it relates to fighting fraud in your area and helping your family and friends to do the same. I've heard since becoming a mother that, you know, it really does take a village, and I can attest to that. And that saying goes definitely for fighting fraud as well. So let's talk a little bit about the difference between fraud, abuse, and errors. So this is where things can be intentional or unintentional, but the result is still the same, okay? Fraud is when someone intentionally falsifies information or deceives Medicare. Abuse is when healthcare providers or suppliers don't follow good medical practices, which results in unnecessary services and or visits being provided. Errors is last but certainly not least. Can be totally unintentional, and it can just be a slip of the finger, right? A clerical error that was unintentional, and it can wind up in a miscoding of a service, resulting in reimbursement differences that Medicare may wind up paying a higher amount when they shouldn't have. Okay, I always take the time to share, while I'm not on Medicare, we had an unintentional clerical error impact my children after they were discharged from the NICU almost 3 years ago. We wound up getting a hospital bill for one of my kids. I have twins, for $600. I said, well, that's strange, because I could see on both of our explanation of benefits, both children had the same service billed on the same day, but one was paid and one was not. And all it took was me seeing something and saying something and taking the time to call the billing office and say, how come this is this way? right? What's up? What's up with this? So all it took was saying that, and the billing staff realized that was an unintentional clerical error on their part, resulting in me being billed for $600 that I should not have been billed. They resubmitted the claim, it was corrected, and we never had another copayment or anything to pay. So just a prime example of really taking the initiative and being vigilant and really watching what comes to you, whether it's an explanation of benefits if you're on a Medicare Advantage plan, or if we're talking about your Medicare summary notice if you have A and B Medicare, and that's how your claims are being processed. But regardless of whether or not what's happening is intentional, it still results in Medicare money being lost. And if last year alone, again, Medicare lost over $60 billion, what can we do to help fight this? Okay. I'm going to talk a little bit about some examples of fraud. This is when Medicare or Medicaid is billed for services that maybe you never got, equipment that you received, or excuse me, that you never received, or that was maybe returned. Maybe you had a CPAP machine for a while, but then you wound up returning it. Or maybe you were using an oxygen tank for a period of time, but it wound up being returned. But for some reason, you're still being billed. Documents that are altered to gain a higher level of reimbursement. Sometimes we see that where hospitals may bill that patients are malnourished when in fact they're not malnourished at all. But if it's coded that way, then they can gain a higher level of reimbursement. Misrepresentation of dates or descriptions of the services that were rendered. If someone uses your Medicare or Medicaid card with or without your permission, or if a company uses false information to mislead you into joining a Medicare plan. The last one is usually the one when I'm out in person, people start raising their hands saying, I get phone calls every day from people who say they're with different, maybe Medicare Advantage plans, or they want to sell me a supplement or what have you. Please do not let those folks mislead you into joining something that you really don't want to join. Okay, that's very, very important. Now that we have just a little bit of a taste of the background, let's talk about what's happening here and now, because Baltimore County is not immune to experiencing Medicare fraud. New Medicare cards. This is a big one. So back in the very beginning of 2020, everybody had received brand new Medicare cards. That was because the old Medicare cards with your identifying number being your social security number was totally done away with, and everyone was sent new cards with new Medicare numbers. And again, that was done to protect you, because if everybody who's a Medicare beneficiary is walking around with their social security number in their pocket, that's a great way to have it stolen, right? And that's very important information that we need to keep close. So what's happening in this particular scam is that phone calls are happening to Medicare beneficiaries, and the folks on the other line say, hi, I'm so-and-so from Medicare. That's your red flag number one, because Medicare doesn't call, okay? But number two, if you're on the phone long enough to hear what these folks have to say, they may tell you, oh, Medicare is going to issue you a new Medicare number and card. But this Medicare card, lucky you, may be preloaded with funds. It can act as a debit card, and it may even have a chip, just like we see with our bank cards now, right? That is not happening, okay? This is a tactic that they're using to entice people to say, oh, that does sound really nice, right? But if it sounds too good to be true, it probably is. So the other thing that we're also seeing is that sometimes these folks are telling people in a very nasty way, if you don't accept this card, if you don't give us your Medicare number and confirm it with us, we'll take your car, we'll take your house, we'll take everything you own. I've had that be reported to our office before. So please, when I say it's happening, it is absolutely happening. But before they can even get further, hang up the phone. The last thing I want is for someone to say, wow, that does sound good. Here's my Medicare number and my information to confirm for your records. Don't do that, because you have no idea who you were chatting with on the other end of the line. So how can we be a fraud fighter in this specific scenario? As I said, Medicare does not call beneficiaries. That is your first red flag. If they need to reach you, they will contact you by mail. Social Security is the same way. They will not call you, they will reach out to you by mail. And again, if you're on the phone long enough to say, hey, wait a second. I remember Shelby, from Shift doing that live stream a couple weeks ago, and Medicare doesn't call people, and they're asking me to confirm my Medicare information. This isn't right. Hang up the phone. Arthritis kits. This is a big one, and this one can actually be very, very expensive to the Medicare program. Excuse me. So this can happen a couple different ways, whether it's by telemarketing, phone calls, TV ads, and even door-to-door salespeople. And what they're trying to promote are these all-purpose arthritis kits. They're trying to tell beneficiaries that you'll be relieved of chronic joint discomfort if you accept this kit. It'll be filled with high-tech braces that are the latest in arthritis resolving technology. But instead, if you wind up actually getting these arthritis kits, you'll be receiving Velcro braces and assorted knee and ankle wraps. It is not something that is the latest healthcare technology. It is not high tech, but they're trying to get you to have them bill it so that way they can charge Medicare and then get some money. Okay. In these instances, Medicare may be billed up to $3,000 for state-of-the-art braces and splints, even though that is not what you are receiving. Problematic, right? That's a huge chunk right there, a very large chunk of change. But you'll also see in the next case that I'm going to share with you that sometimes even those little teeny tiny charges can also really add up. But first, let's talk about how to be a fraud fighter as it relates to the arthritis kits. If you're calling a number that you see on the TV, or if you're responding to a telemarketer, do you really know the person who is on the other end of the line? No. Are they a physician? Are they even medically trained to be able to say, oh, yes, that person does need something like this to relieve their joint pain? You have no idea. If you feel that you need a piece of durable medical equipment of any kind, whether it is a back brace, a knee brace, um, an ankle brace, or maybe a wheelchair or walker, anything, please contact your personal physician, someone that you know and trust. Okay, because they are the people that you really want to be interacting with, because otherwise you have no idea, again, who is doing what with the information that they just got from you. If someone comes to your house, because sometimes these folks are operating in a door-to-door manner, don't answer the door. You owe them nothing. You do not have to open the door. But if they leave any identifying information as it relates to themselves, maybe a business card or something in your mailbox or in your door, hold on to that information and call SMP. And I'll give our contact information out at the very end. But I try to have people be strategic because, yeah, I don't want you interacting with people in person that you don't know. I don't like that people are coming to other people's homes. That, makes me very uncomfortable myself as well. But if they leave anything for you, hey, take it and let us see it so that way we can say, hey, this person might be a Maryland insurance representative, and we need to report them to the Maryland Insurance Administration, right? We want to make sure that these folks who are not doing things appropriately are being held accountable. Last but not least, this is so prevalent. I know there have been stories aired on local news stations about this. There have been articles from the Kaiser Family Foundation, from the New York Times, Washington Post. This is a buzz topic, and this is happening. So COVID-19 at-home test kits. So We're all very aware of the COVID-19 pandemic, and we may or may not be aware that the public health emergency ended last month. What also ended was the Medicare coverage for at-home COVID-19 tests as soon as that public health emergency stopped. The coverage was that if you had Medicare Part B, you could go to a pharmacy or wherever and get up to 8 over-the-counter at-home COVID-19 tests per month for free. Okay, but now that the public health emergency has ended, so does that benefit. If you need a COVID-19 test, though, and you feel ill and you go to your doctor, that is still covered by Medicare, just so everybody knows. But what's happening with this current scam is that beneficiaries might be suddenly getting all of these boxes of COVID tests, but they never ordered them. They never requested them, and neither did any of their family or friends on their behalf. Some folks, though, are never getting the tests, but they're noticing that they're being billed when they look at their Medicare summary notice. Okay? So, how to be a fraud fighter in this instance. And we are telling people, if you've gotten COVID tests that you didn't order and you live in Baltimore County, call our office. We will need to get some information from you, but we are trying to escalate these to the Office of the Inspector General as well as the CMS regional office for our area. So this is very serious, and it is, I don't want to speak out of line, but I believe it is possibly on its way to being one of the biggest Medicare fraud schemes. So we'll see what happens. This is where really, if you see something, say something. Look at your Medicare summary notice, right? What if you never got the test to be that red flag to say, well, I didn't order that. But you look at your Medicare summary notice and you see for the last 3 months, Medicare has been billed on your behalf for COVID tests. Right? If you're actually getting the test and they're being delivered to your house, but maybe you don't have your Medicare summary notice or it hasn't come yet to check, report that, because you're seeing something, you're just seeing it in a different way. You're getting the test, but you're not sure about the billing, whereas the other person might be seeing the billing, but never getting the test to be that red flag. And please call your local SMP to report. Now, one scheme that I actually just had somebody report last week, and I didn't have a chance to update this presentation, is that folks are being billed for urinary catheter supplies when they never requested them and they don't need them. That is very serious, because if you're not paying attention to your Medicare summary notice and you're never getting the supplies to be your red flag, you can wind up being billed for thousands of dollars. Somebody that I chatted with just last week, Medicare was billed, it was over $20,000, I believe, over the last year, right? And that is an incredible amount of money. And it's those things that just keep ticking, ticking, ticking to that 60 billion, right? And one day we may wind up surpassing that as well. But there's all types of different fraud out there. And what's most important is to remember your 3 R's to be an active fraud fighter, okay? The 3 R's are record, review, report. Record. Write down information when you go to the doctors or when you've placed orders for tests or certain medications, right? I always tell people, how are you supposed to know what happened at your doctor's appointment if your Medicare summary notice only comes quarterly, right? You could have your appointment in January, but not get your Medicare summary notice until March or April. Well, sometimes I forget what I had for breakfast the same day. So write it down. Keep a record of that information. It'll only help you. Review, our second R. Look at that Medicare summary notice when it arrives quarterly. I know so many people get it in the mail and they say, yeah, but I already know what doctor's appointments I've been at. Shred, right? Please don't do that. It is in your best interest to take a look every single time you get it, just to see if there is anything that does not look right, okay? Because you may wind up seeing some charges, maybe one, maybe several, that you don't recognize. Report. If you think something's a clerical error, call the billing office of your doctor or the hospital, okay? If you see something, say something. Again, sometimes it can be intentional, sometimes it's unintentional. Please also feel free to contact your SMP office, that's us, to report any concerns or suspected fraud that you believe you may have been a victim of, whether it's the COVID test, maybe you've gotten arthritis kits, maybe you had somebody that came and knocked on your door and they left some information, but they made you really uncomfortable. Well, they're not supposed to be coming to your door if they don't have an appointment. So, any type of fraud that's out there or things that you're experiencing, we need to know about. So that way we can escalate them accordingly so we can fight fraud together. Now, I've alluded to contacting the SMP office, and you're probably like, well, will you please give us the contact information? You can reach us by email at medicareinformation@baltimorecountymd.gov. Please include a phone number where we can reach you. If it's related to fraud, I myself will be reaching out to you because all of these cases are considered complex and they are handled by me directly. But please don't include any of your personal identifying information like your Medicare number or anything like that. Do not include that in your email to us, okay? Just give us kind of a base story of what's going on and just include a phone number so we can chat by phone. You can also call us if you'd like, 410-887-2059. But I do like to let people know we don't answer phone calls live in our office, so you can go ahead and leave a voicemail, but please indicate that you believe that you've been the victim of suspected fraud, and I will be more than happy to reach out to you and to handle each case accordingly. That is all I have today. I'm going to go back just to the front here, the Fraud Prevention Week. Be a fraud fighter, everybody. While I know we started with the Star Wars theme song, I also have Eye of the Tiger kind of like going in my head, just like, yes, be a fraud fighter. Do whatever you can. Help those around you, right? These presentations are not only to educate you, but to also get the word out to others, because maybe those on Facebook or maybe other family members that you have in other states have called you saying, yeah, I keep getting these COVID tests. What's up with that? That's weird. Well, now you know, and now you know how you can direct them to contact their SMP office, to contact Medicare, and to do whatever we can together to fight fraud. So if anybody has any questions, please feel free to drop them in the comment section of the live stream. I'd be more than happy to stay on and answer any questions that you have. But that is all that I have to share, and we will be sharing additional information throughout the week in honor of Fraud Prevention Week 2023. Do we have anything, Ethel?
Yes, what a great presentation, Shelby. Lots of good information. And the question that I received is, if someone goes on and has a My Medicare account, can they also watch their summary notices through that feature?
That's a great question. Since they don't allow SHIP counselors who are not Medicare eligible to have a My Medicare account, it makes it a little challenging to know all of what beneficiaries have access to. However, I believe that you can review claims and your Medicare summary notice online through that feature, if I'm not mistaken. So absolutely check on your My Medicare account if you have one, and if you don't have one, sign up. It's there for you, and it's a great hub for all of that information. So if you can access the Medicare summary notice, which I'm like 99% sure that you can, I just can't double check because I don't have an account. Definitely review that information and take a look at past Medicare summary notices that maybe otherwise you just said, I don't think I need to look at that, and see if anything raises some red flags or alarms to you, okay? Because it doesn't matter how long ago it happened. We want to know that it happened to you. Because again, we just talked to someone last week who said they noticed it on this Medicare summary notice, but when they called Medicare, they had been billed all the way back to April of last year. So definitely take a look at what other things that you've maybe not paid as close attention to, but now you know for the future. Great question.
And then do you have a tool that you recommend in keeping like the journal entries that you spoke about in regard to doctor's appointments and labs and tests that you're scheduled for?
That's a great question. So some people just bring little notebooks. We actually in our office have what's called healthcare trackers. And if anybody would like a healthcare tracker, you can feel free to call the SHIP and SMP office, the 410-887-2059 number. If you want the healthcare tracker, go ahead and ask for it in the email, but just make sure to leave your mailing address and your name so that way we can send it your way. I believe I think I have a whole box actually sitting over here. There's some other things on top of the box that I can't see, but I believe we still have a number of them, and I'd love to get them out to people because that's a really great structured way, and it's nice and compact to make sure that you're documenting everything that you should be documenting.
Ooh, that sounds like
Great
an
question.
excellent tool.
Yes.
And then lastly, is there a website that they can watch to see what the recent scams are so they can be aware?
That's a really good question. So if you visit, hold tight, I'm going to stop sharing my screen just for a second because I want to hop on the SMP site, which is Senior Medicare Patrol. I just want to get you the correct website. So if you visit www.smp, that's S as in Sam, M as in Mary, P as in Paul, resource.org. I'm trying to get the site to come up for me. At the very top, they have a ribbon that says consumer fraud alerts, right? Right there at the top of the page. That's a great way to see what might be happening, whether it's in our area or not. If it's happening somewhere else, it very well could come to us as well. But right now, they have the COVID-19 scams highlighted there as well. Also, keep an eye on newspapers like New York Times, Washington Post, anything out there. Kaiser Family Foundation is another great one where I frequent their articles just to see, hey, what are they reporting on, right? And a lot of times Kaiser Family Foundation is what is cited in the other articles. So it's a great place to start. Um, and be on the lookout for any information from Medicare and even check out local news stations because I know for a fact that WBAL was a news station that was actually highlighting the COVID-19 scams and highlighting what we as collective SMP agencies and the Maryland Department of Aging is also doing to try and help educate folks about this happening. So there's information out there, but you're absolutely right. Knowing where to look is key. So please check out the smpresource.org site. Great resource. Kaiser Family Foundation is great. And then again, just kind of be vigilant. If you're listening in to WBAL talk radio, or maybe you're just kind of catching the evening news, hey, sit down and really listen sometimes because you never know what kind of stories might show up on there as well, right? So great question though. Thank you for asking that.
Shelby, that is all the questions that I have right now. I guess I'll turn it to you for a close.
All right. Well, everybody, thank you again so much for joining us. And Ethel, as always, thank you for your support in making this live stream happen. I want everybody this summer and, starting today forward to be a fraud fighter and to think like a fraud fighter. And that doesn't only mean for you, but it means for the village around you as well. Okay. So if you have parents, if you have friends, if you have other family members or people in your circle who maybe just happen to off the cuff say that they've received something or they got a nasty call or something like that along those lines, tell them what to do. They may not know that we exist and they may not know to call us if they're experiencing those trials and tribulations. Okay, so please be a fraud fighter for yourself and for those around you so we can all help fight Medicare fraud. Thanks, everybody. Happy Fraud Prevention Week, and stay tuned for all of the rest of the material throughout the week. Have a great day.